My name is Mike Lee. Today's topic is transgender population and vulnerability in healthcare system. For today's topic, I would like to use transgender community as our vulnerable in the healthcare area. First, let me describe the definition of transgender. Transgender people are people whose gender identity is different from the birth sex they were assigned. For example, a boy who later on in life found out that his gender identity is female, or somebody born as a girl will that find out at some point that her gender identity is male. Many transgender people at some point may change their gender role and take hormone and even undergo surgery to change their bodies to their identified gender. According to the article by A.H. Grossman, transgender youth experience of vulnerability in health and mental health area challenge. Peer pressure and family unacceptance also present challenge. Also, transgender people suffer from bullying from peers. Transgender individuals report high rate of mental health diagnoses. Transgender youth have been diagnosed with self-injury disorder, depression disorder, and anxiety disorder in more significant number than the general population. Society should be thinking about explaining those mental health disparities. Homelessness creating additional home concern. Transgender youth often are kicked out by their family and become homeless at a young age. Alternatively, they may have to find some places to sleep over by using a dating app or going to a stranger house, which expose them to sexual assault or rape. Youth notice four problems related to their vulnerability in health-related areas: the lack of safe environment, poor access to the physical health service, inadequate resources to address their mental health concern, and a lack of continuity of caregiving by their family and community. There are no global statistics I can find online for the transgender population. However, over 1.6 million adults aged 18 and older and youth aged 13 to 17 identify as transgender in United States, or 0.6% of those aged 30 and older. Statistics regarding the number of transgender people in variety locations are: Massachusetts, 37,000; other New England states, Maine, 5,900; New Hampshire, 63,000; Vermont, 27,000; Rhode Island, 5,700; Connecticut, 50,300. California, with individuals identified as transgender, is 150,100, the most significant number of any state. It does not indicate vulnerability in other areas of USA. It is only an indication of living population of the state, and it is more like a percentage of the population. It does not mean that Californians tend to become transgender person. Transgender are naturally born, and even transgender people tend to move to an area where they feel welcome and safe. However, it does not mean California has more because of transgender individuals move to California. This key health concern impact the transgender people. This involves their exposure to risk, discrimination, marginalization, and access to supportive resources. Furthermore, surprisingly, even the LGBTQ community, like the lesbian community, is not welcoming transgender people to the community. As a male to female transgender, some of them are still content with their male productive organs. Hence, the lesbian community sees them as male. Even female to male lesbians seem to have too much male outlook and voice. The straight community sees them as not real male or female, so transgender people usually have trouble finding a partner. This emotion of unacceptance or forever loneliness lead to transgender cause life stress and increasing the chance of mental health suffering. The protective role of family in society transition transgender children is essential to mental health. Children support in their gender identity have limited level of depression. Parental support is associated with higher life satisfaction and lower perspective of being transgender, fewer depression symptoms, and less suicidal among transgender adolescents. Transgender youth with high level of family support and connectedness report better health. Common health problems identified in transgender group. Hormone therapy causes them to have an increased chance of have heart problem. The use of testosterone by transgender male does seem to be increased with the cardiovascular risk. On the other hand, science seems to point vulnerability and common health concerns in transgender group. Hormone therapy causes them to have high sex appeal. For transgender men, the sexual drive was initially increased at 3 months, giving them greater chance to find multiple partners and one night stand. Thus, they have a higher rate to have STI or HIV. Transgender youth have higher mental health concern rate than cisgender youth. Variety area of concern: verbal abuse, having difficulty with, are facing difficulty with employment, obtaining housing, and accessing health service. The stress that emanates from those challenges translate into higher level of anxiety and depression. Transgender individuals have reported have suicidal thoughts, had a suicide plan, attempt suicide, engage in self-harm, and have clinically significant depression. In consideration when care for a transgender group, nurse attitude and belief system affect the care of transgender individual. Nurses must know the terminology and know the vocabulary so that nurse can have a conversation with the patient. For instance, one must know the difference between sex, gender, and sexual orientation. Nurses need to know what it means when patients say they are fall under the specific umbrella. So nurses need to know sex, gender, sexual orientation, and what the term mean underneath those definitions. So, for instance, nursing care consider need to know whether the patient is cisgender, mean transgender patient non-binary, pansexual, asexual, then homosexual. Nurse need to know all those words to discuss this with the patient. Do not assume anything. Never assume that when somebody say their partner is coming, it will be somebody of the opposite gender. Please do not assume that the person in the room with the patient is their romantic partner. Ask what the relationship is. Please do not assume that patient is straight or gay or lesbian based on their presentation or overt expression of who they are. There is no way to tell who is and is not a member of the LGBT+ community without knowing that they are. There is no way to tell from someone's outward appearance, how they talk, their haircut, and anything like that. So please do not make those assumptions about patients, because when nurses make those assumptions, they possibly disrespect patient simultaneously. We do not want that, so do not make assumptions. Instead, ask, who is this here with you? Ask the question, not just, are you sexually active? It's an essential question for you to know for medical purpose. But then, with man, woman, or both, do not assume that they are sexually active and that is with someone of the opposite gender. It would help if nurses respectfully ask those questions when it is appropriate. Also, further training, if needed, educator incorporate curriculum in transgender education in nursing program. This is the end of my presentation. Thank you.